bringing you the latest updates on viral outbreaks affecting communities worldwide. In today's report, we will cover the escalating avian influenza situation, the resurgence of various viral infections in the United States, and recent developments concerning the Marburg virus disease in Tanzania. The ongoing spread of avian influenza, commonly known as bird flu, continues to raise significant concerns worldwide. In the United States, egg farmers are increasingly worried about the relentless transmission of the virus. Despite substantial investments in biosecurity measures, the disease has forced the culling of millions of birds. Greg Bruck, CEO of Herbruck's Poultry Ranch in Michigan, has described the virus as a terrorist, emphasizing its destructive impact. Experts are now advocating for the vaccination of poultry as a potential long-term solution. However, there is ongoing debate over whether vaccinations might mask infections, complicating international trade. Emily Metz, president and CEO of the American Egg Board, has stressed the urgency of employing all available tools, including vaccination, to combat the virus effectively. Beyond poultry, the virus has been detected in various mammalian species, including dairy cows, raising concerns about its potential transmission to humans. Since March 2024, the Centers for Disease Control and Prevention, CDC, has identified 64 human cases of H5 bird flu in the United States, primarily among farm workers. Tragically, one fatality has been reported in Louisiana. While health officials maintain that the risk to the general public remains low, this situation underscores the need for ongoing vigilance and proactive measures to prevent further spread. The United States is also witnessing a notable resurgence of several viral infections that had either been under control or previously considered seasonal threats. Influenza cases have surged dramatically this season, with 43 states and the District of Columbia reporting high flu activity. So far, the virus has caused 24 million illnesses, 310,000 hospitalizations, and 13,000 deaths, including at least 57 children. For the first time since the COVID-19 pandemic, flu-related deaths have surpassed those from COVID-19. Experts point to prolonged flu seasons, declining vaccination rates, and the circulation of multiple flu strains as key contributing factors. The return of whooping cough, pertussis, is another alarming trend. Once nearly eradicated due to widespread childhood vaccinations, whooping cough is making a comeback, with 32,000 reported cases in 2024, the highest number in a decade. At least a dozen deaths have been linked to this disease, primarily in unvaccinated infants. Public health officials attribute this resurgence to declining childhood immunization rates, with only about 92% of kindergarteners receiving their DTaP vaccine during the 2023-2024 school year. This figure falls below the 95% federal target needed to maintain herd immunity and prevent outbreaks. Measles, which was declared eliminated in the United States in 2000, has re-emerged in various states, including Alaska, Georgia, New York, Rhode Island, and New Mexico. The increase in cases has been closely linked to communities with lower vaccination rates. Health experts warn that if the current trend continues, measles could become endemic again, posing a severe risk to those who remain unvaccinated. The winter season has also seen a significant rise in norovirus outbreaks. Known for causing severe gastrointestinal distress, norovirus cases have been nearly double what they were last season. Between August 1, 2024, and January 15, 2025, over 1,000 outbreaks were reported across 14 states. Although recent data suggests a slight decline, infection rates remain elevated, and health officials urge the public to take precautions such as frequent hand-washing and proper food handling to prevent further spread. While COVID-19 no longer dominates headlines as it once did, its presence remains significant. This winter's surge has been more manageable compared to previous years, largely due to increased immunity from past infections and vaccinations. However, more than half of U.S. states continue to report high or very high viral activity in wastewater, indicating that community transmission is ongoing. Public health officials are closely monitoring emerging variants and encouraging at-risk populations to stay up to date with booster vaccinations. Another respiratory virus, RSV, respiratory syncytial virus, which primarily affects infants and older adults, has been on the decline in recent weeks. The relatively mild RSV wave this season has been attributed to increased vaccination efforts, particularly among vulnerable populations. While this is a positive development, experts caution that RSV remains a significant health threat and continued immunization efforts will be necessary to keep future outbreaks under control. Moving to Africa, the United Republic of Tanzania is currently grappling with an outbreak of Marburg virus disease, MVD. Since the outbreak was officially declared on January 20, 2025, the Tanzanian Ministry of Health has reported 2 confirmed and 8 probable cases, all of which have resulted in fatalities. The outbreak is centered in the Biharamulo district of the Kagera region, marking the country's second recorded experience with MVD. The first occurred in March 2023 in the neighboring Bukoba district. Marburg virus is a highly virulent pathogen that causes severe hemorrhagic fever, with a case fatality rate as high as 88%. The virus is transmitted to humans through direct contact with infected fruit bats and spreads further through human-to-human transmission via bodily fluids or contaminated surfaces. The World Health Organization, WHO, is actively working with Tanzanian health authorities to contain the outbreak. Measures include contact tracing, community engagement, and the provision of essential medical supplies and personal protective equipment for healthcare workers. The global health landscape remains challenged by a series of viral outbreaks, each presenting unique threats to public health. The avian influenza situation highlights the need for innovative prevention strategies, including poultry vaccination, to protect both animals and humans. The resurgence of vaccine-preventable diseases in the United States serves as a stark reminder of the importance of maintaining high immunization rates to prevent outbreaks. Meanwhile, the Marburg virus outbreak in Tanzania underscores the necessity for rapid response capabilities and effective disease surveillance to contain deadly pathogens. Public health authorities worldwide are actively monitoring these situations and implementing measures to mitigate the spread of these viruses. Individuals are encouraged to stay informed, adhere to public health guidelines, and participate in vaccination programs to protect themselves and their communities. Thank you for joining us for this comprehensive update on global viral outbreaks. Stay safe and stay informed.